Hello everyone, I'm Dr. Nurettin Noyan. I want to give you a brief information about the tuberous breast asymmetry or tuberous breast deformity. First of all, what is tuberous breast deformity? Tuberous breast deformity is a rare condition of the congenital breast disorders. In these cases, patients' breasts, especially the lower poles, cannot get grown like the upper pole. So there will be a disparity between the upper and the lower pole of the breast. When you look at the breast, usually the breast is not in a round shape, it's much more like a triangular shape, and especially in the public, some ladies make a simulation like it's like the mommy goat's breast. So the breasts usually look like a much more triangular shape, not a round shape, and the areola, which is the brown circle of the breast tissue, it is much more larger than the normal small breast. Why it is happening? Because usually there are some constricting bands which is connecting to the lower pole to the nipple can be much more tighter than the normal. So during the surgery, we are struggling to break down these bands and to make much more volume for the lower pole. Now, let's talk about how we treat the tubular breast asymmetry. You have to be under general anesthesia for an operation, and we must use an implant to correct this deformity. First of all, this preoperative surgical planning is very important for the patient and the doctor to put the lower pole of the implant, which will stay at the end of the operation, because usually the distance between the nipple to the inframammarian fold is too low in this patient, so you have to lower the inframammarian fold. After that, you have to choose an appropriate size and shape of the implant. Patients who are eager to have a much more natural results must choose these implants in an anatomic shape, but patients who are willing to have an upper pole fullness at the same time may choose a round implant at the same time. So it depends upon the patient desires at the end of the operation result. During the operation, in my hands, it usually takes 45 minutes to 1 hour operation, and sometimes patients are asking to reduce the areola diameter at the same operation. Sometimes they come back for the second revision surgery to reduce the areola sizes. Sometimes there can be asymmetries between the right and the left side for the tuberous breast asymmetry, and sometimes there may be small asymmetries at the final result. How can the patient pass the post-operative time? It's like the same in the breast augmentation surgery. Patients must stay 1 night in the hospital for the early recovery, and the incision size usually will be in the inframammarian fold, and we have to be at least for 1 month be careful about the incision site to keep them clean. At the end of the operation, there may be a little bit unnatural result, especially for the upper pole fullness, but by time, in 6 months, it will get much more natural day by day.